Hello, it's Jim Huddy, and welcome to our March 2018 update for the Cornwall's Opioid Strategy project. What I've got here is, first of all, we think a fairly eye-catching Hollywood-esque promotional video, which is pretty brief. And then I've got about a 5-minute talk by Keith Mitchell, consultant at RCH in the pain clinic, who's going to describe things in a little bit more detail. We hope you enjoy it.
Hello, I'm Keith Mitchell. I'm sat in the pain clinic, and this is a brief presentation to introduce who these guys before you are, why they meet every other Thursday, what they do, how they're doing, and what they plan to do next. I imagine that everyone in the room is aware that we, the medical profession, have been overusing opioids for years to the detriment of individual patients and to society at large. And we've taken it upon ourselves to come together to try and highlight these issues to our colleagues and to the public, and to try and give people resources to reduce this issue. A large proportion of our work has consisted of us banging on to anyone who will listen, basically, patients, colleagues, the public at large, to inform people of these issues and to try and give people ideas as to how to address them. I thought I'd highlight a few specific initiatives and give a quick view as to how the overall project seems to be going. We start with Trilisk, which is of less interest to most people, I'm guessing. Here's a policy that makes it clear that intravenous morphine is for the rapid control and titration of analgesia in the acute situation and is not to be used in an ongoing pain issue. Here's an email that I have sent to me from the prescribing system every day with information about any patients who've had opioids for more than 48 hours, so I can take action as I feel appropriate. And here's a chart that gets automatically formed for me, so that if I don't check my daily emails, I can look back and see any patients who might be running into issues with excessive use of opioids, so I can take appropriate action. How have we done in all this? Well, we know how much opioids that we're using across Trilisk, and here is a bar chart showing its use over the last 2 years. I reckon that overall the use of opioids across Trilisk has reduced across the board by about 20%. And I reckon the use of intravenous morphine specifically has reduced in RCHT by about 40%. This seems to be accompanied by a reduction in the appearance of tricky patients with tricky complex symptoms, camping out in hospital beds and demanding intravenous morphine for prolonged periods. Moving out into the community, I suspect that the largest impact, apart from our presentations, has been the construction by Jim Huddy of a section on the KCCG website with resources for GPs and patients aimed at allowing people to reduce opioid use. This opioid management bundle is one of the many resources that Jim's put on the website. If you haven't seen the website or haven't seen it recently, then shame on you. Get on the internet and take a look. How are we doing? Well, here's a graph showing prescribing overall in Cornwall in red and prescribing overall in the UK in blue. In Cornwall, use of opioids is excessive, but it's coming down, I reckon, by about 8% over the course of the 2 years of this slide, compared with a slight increase of about 2% in the UK overall in blue. We have information about individual GP surgeries, what their prescribing levels are, what drugs they're using, and we can use that to target individual surgeries to help them. We can use that as feedback for individual surgeries as to how they're doing over time and how they're doing compared to their peers. So what's the latest? This year's GP incentive scheme is going to include some work in trying to reduce the overuse of opioids. Exactly how that's going to work is still under discussion. We're still also in discussion as to how best to update GPs on how they're doing in reducing opioids in their surgery, how they're comparing to their peers. Hopefully some discussions about those might come from today's meeting. And I'm here to mention Jim's latest videos on deprescribing opioids and on the overall use of opioids. Hopefully this screen is familiar to everybody here as the place to go to find Jim's internet-based resources for opioids. Here's how the screen looked a few weeks ago with the links to video presentations. I'm reliably informed that there are now links to the new 30-minute long and superb videos regarding the deprescribing and the general overall use of opioids. Thank you very much and enjoy the rest of the meeting.